Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about placental abruption, or simply abruption. Thankfully, this is a pretty rare event, but it can be very serious. Less than 1% of all pregnancies experience an abruption, and there are some steps you can take to reduce your odds of abruption, but some of them happen and we don't have an explanation for them. And it can be seriously life-threatening for the baby or for yourself. The main risk factors for abruption, number one, is trauma, is following injury to your abdomen. So that's why we caution you to avoid activities that could increase your odds for such trauma, like riding a four-wheeler, or especially riding a three-wheeler, or riding a horse. I discourage that. It's hard to predict a horse's behavior, even if you are an experienced rider. Or car wrecks, so unnecessarily dangerous driving circumstances should be avoided. Also, that's why I encourage you to avoid getting up on ladders, to avoid falling from a ladder or from high places. But trauma, nobody wants to experience trauma, so we all make efforts to avoid that. So what else is a risk factor for abruption? Well, smoking. Smoking, marijuana use, drug use, alcohol use, meth, cocaine, but smoking is quite does give you an increased risk of a spontaneous abruption. In fact, I would say throughout my career, probably 90% of the patients that I've witnessed who just come in with an abruption without having trauma were smokers or had used other drugs. So you can see my other video on avoiding smoking, but we definitely encourage you to stay away from those substances, and especially smoking and vaping as well. Okay, that aside, what is an abruption? It is when the placenta can partially separate or completely separate, which is catastrophic, and there's blood in between the placenta, the afterbirth, and your uterus. And in that space, there can be a small amount or it can be larger. If it's less than 20 weeks, we generally call it something called a subchorionic hemorrhage, but it's blood trapped there and it irritates the uterus. There's a natural response for the uterus to think, well, there's something up, so it starts contracting and often can lead to early delivery. And the placenta is your connection to the baby. Your blood and the baby's blood flow through intimately at the placental junction, and that's how you exchange oxygen and nutrients, food, for the baby. And so when that separates, that can decrease the amount of surface area that has the exchange, and if it's significant enough, can limit the nutrients and oxygen of the baby, and that's why it could be life-threatening. A small abruption doesn't do that, but it might irritate the uterus and cause contractions, which can increase the size of the abruption, or they can also cause early delivery. The hallmarks of abruption are painful contractions and vaginal bleeding, but not all vaginal bleeding is an abruption. The most common reason in the second or third trimester for vaginal bleeding is either an infection or a little spotting after intercourse. But significant, hard, painful contractions, painful abdomen, and vaginal bleeding is an immediate emergency and warrants you to get to the hospital right away. As I said, the good news is this happens to less than 1% of pregnancies, and with timely intervention, then the outcome is often very good, but you might need emergency C-section. And so when there's a concern, please contact your healthcare provider. That being said, I have a whole other video on abdominal pain in pregnancy, And there are many more common explanations for abdominal pain in pregnancy than an abruption. So I hope these two videos will give you some broad knowledge to help you sort things out, to reduce your worry and concern. However, whenever in doubt, it's certainly a case where you should be consulting your healthcare provider or seeking help sooner rather than later. I hope you found these useful, and please leave your comments. Thank you.